Hi, Virgilio here. We're producing this informational video to give you an update on some of the changes that have occurred with the Wise Women program, the Women's Wellness Connection, and the Komen program that we help to provide here at the Salud Family Health Centers. These programs offer breast and cervical cancer screening, blood sugar, BMI, lipid, and blood pressure services, and require a multidisciplinary team approach from the front desk to the medical support staff, including all the providers, the WWC coordinators, and patient health educators. We're pleased to provide the Women's Wellness Connection and the Wise Women program at the Salud Family Health Centers. This video is intended to update you on the new SOP that will allow you to understand how we're going to implement these programs this year.
Welcome to Salud. How can I help you today?
I'm here for an appointment.
According to our records, I think you may be eligible for programs that provide you with women's health services. If you complete these forms, you'll learn more about these programs and potentially get these services for free.
Oh, thank you. This is going to be so helpful for me.
These services will cover a Pap test, a clinical breast exam, a mammogram, and cholesterol as well as glucose screening. Okay, let's have you speak with one of our cashiers.
Ms. Castillo, I see you have completed the enrollment paperwork for our Women Wellness Connection program and Wise Women program. We will make sure that you're not charged for any of these services today.
The goal of the Women's Wellness Connection and Wise Women programs is to provide free breast, cervical, and cardiovascular disease screening services through an integrated office visit. Women are eligible to participate in these programs if they are 40 to 64 years old, uninsured, 250% or less of the federal poverty level, and lawfully present in the United States. To enroll women in the programs, customer service associates and enrollment specialists will provide every woman age 40 to 64 and only on CICP with an enrollment packet. Depending on what service the woman is there for that day, the packet will be given to the WWC coordinator for future appointment scheduling or taken to the exam room. The next scene shows the integrated office visit.
My medical assistant mentioned that you are eligible for the WWC and Wise Women programs. So today we're going to do some cancer and cardiovascular screening. We will do a Pap smear and get you scheduled for a mammogram. We'll also do some blood tests and check your blood sugar and your cholesterol. Do you remember when your last Pap was?
Maybe 3 years ago. I don't remember for sure.
The USPSTF recommends a Pap smear every 3 years or a Pap smear with HPV co-testing every 5 years. A mammogram every 1 to 2 years starting at age 50. For women with an increased risk of breast cancer, mammogram screening starts at age 40. Under the Komen program, we can do screening mammograms every 2 years starting at age 40. Once we've finished with your exam, our patient health educator will come in and discuss your results. She may call you for an appointment or to discuss your lab results. Your paperwork will go to our WWC coordinator and she will make sure everything gets done with your mammogram.
Once the integrated office visit is completed, the WWC coordinator at each clinic will:
Number 1. Make sure the forms are filled out completely and determine which program the patient is eligible for. Number 2. If the WWC coordinator receives paperwork for patients who were not in the clinic that day for an adult wellness visit, the WWC coordinator will call the patient to schedule a wellness visit in the future and make a billing note saying, WWC Wise Woman do not charge. Number 3. Scan, fax, or interoffice mail the completed packet to Laura Montoya in administration. Number 4. The WWC coordinator schedules the mammogram and provides case management services to women with abnormal breast or cervical cancer screenings to ensure complete follow-up. Number 5. The WWC coordinator will also notify and give a copy of the completed packet to the patient health educator.
The patient health educator will be involved in the Wise Woman program, which is a sister component of the WWC. This involves screening for cardiovascular risk and providing risk reduction counseling and health coaching sessions. Number 1. The WWC coordinator or medical support staff will provide the PHE the filled out patient information form to provide risk reduction counseling services. Number 2. The PHE will see the patient in the clinic or call the patient to schedule health coaching sessions or offer diabetes prevention program services. Number 3. The PHE will fill out a risk reduction counseling and referral form to track the patient visits for health coaching or DPP referral. Number 4, the PHEs will fill out a medical evaluation form if blood pressure or blood glucose results are in alert values. The PHE will also inform the provider and schedule an appointment within 7 days. Number 6, the PHE director will track the enrollment and engagement of patients in the Wise Woman program and provide updates and information to the CDPHE and contracted vendor for the diabetes prevention program. All of these forms and information about these programs are located on the Colorado Department of Public Health and Environment website under Women's Wellness Connection and Wise Woman programs.
As you can see, these programs are very complex. They take multiple steps. We need many staff members participating, but together we're certain that we can make them very, very successful and do this very efficiently.